my friends from Nova Health are here. Jan Atkins is back. She's from Nova Health, and she's brought a couple of friends with her. We've got registered nurse Dee Lucas is with us. Welcome.
Thank you.
And we also have Tracy Grimes, who has been a patient and a friend of Nova Health for about 4 years. Is that right, Tracy?
Yes.
All righty. Jan, welcome back to you as well.
Thank you.
Always good to see you. Okay, I'm excited because, you know, whenever we have testimonials on, it really, I like that. It's kind of like proof in the pudding, but what makes this one unique is when you're talking about Nova Health, it's a very personal experience. So Tracy, first of all, tell me, before you came to Nova Health 4 years ago, as we said, what kind of symptoms were you feeling?
Primarily what all women experience when they go through menopause, which is hot flashes, fatigue, low libido, just general not feeling great.
Okay.
And we tried to battle it without any help, and I had tried everything before coming to Nova Health. Patches and creams, etc. And nothing was successful for me until I got with Jan.
Okay, now Jan, these are typical symptoms that you hear, right? Fatigue, low libido. I read that you've had a little bit of a failing memory. You just weren't yourself. Everyone wants to feel better, and I don't think it's unusual either, and tell me if I'm wrong, that people try a lot of different remedies.
Absolutely. Typically they come in, they're very frustrated. They've tried to talk to their primary care doctor about their hormones. They're told, oh, your hormones are fine, or you're just getting older, or you need an antidepressant. That's basically a Band-Aid. You have to really get to the root of the problem and address the issue. So we kind of go on a fact-finding mission, and there's a long list of symptoms I go through, and I think Tracy realized that it went much deeper than your typical sweats, flashes, low libido. She has a very important job in the court system, so focus and memory were a big deal to her as well. So
yeah, I knew I'd heard your name. You're a bigwig, aren't you? Come on, Tracy.
Gosh, I'm just famous, I guess. I don't know.
Well, no, and I thank you for bringing that up, because I think a lot of people think, well, a lot of this is about intimacy or energy, but it transfers over to business very well when it comes to focus and energy.
Everyday living, just functioning every day. And I can't say enough good things about it. And I would tell all of my girlfriends, it's the best thing you'll ever do.
Oh my goodness. Now, before we get into details, I want to ask you something, Dee Lucas, who is a registered nurse. Dee, you know, it does go deeper than just the energy, etc. Do you find it common when people come into you and they're saying, well, I feel this, and sometimes they're almost willing to do it. They say, oh, it's a part of growing older. And what do you answer when they say that?
I tell them that yes, everyone has those feelings. Everyone feels bad when they hit a certain age, but you don't have to. You don't have to just accept that you're tired, you can't sleep, you're irritable, you have anxiety, you have mood swings, migraine headaches, joint pain, all that stuff. It's not necessarily a part of getting older if you get help for it.
See, I like that. That's like new age thinking, new technology kind of thinking. All right, Tracy, your experience now. I've noticed when I came in the room, your energy seems great. You feel good. How's your focus?
Focus is good. Energy level is just fantastic. I used to have a hot flash fan that we fondly called at my office that I have completely retired. So I have those issues no more, and
so
that's wonderful.
If someone were to ask you, okay, do you recommend Nova Health? Should I go in? I'm a little apprehensive. You would say? I
would say definitely. It's a free consultation, and Jan is wonderful. She will walk through all of the steps, the procedure itself, and I'll just say go for the free consultation, and you will be a patient.
So you're feeling good. This isn't just for television. You feel great.
I do.
You look fantastic.
Well, thank you.
All right, as Dee does, as Jan does. So obviously Nova Health, the proof's in the pudding right here. All right, Jan, what separates you guys? What makes you a little bit different when it comes to hormone therapy?
Well, I think one of the things that separates us greatly, our physician is a board certified gynecologist. He has 35 years of experience. So if you're going to do natural hormone replacement therapy, there's no one better than a gynecologist. He knows hormones forward and backward. He's excellent at getting someone leveled out where they need to be, so you stay on that even keel. You don't have the peaks and valleys, roller coaster ride.
And speaking of even keel, you guys, if I'm not mistaken, do you all do the pellet therapy, or which way do you do it? Yeah, so from what I understand, correct me if I'm wrong, but the advantage to the pellets is you don't get that roller coaster of hormones. It's a nice steady stream that keep you level. Is that correct?
Correct.
Okay.
Yes, they time release and dissolve and do what they need to do, and we put them in again.
So once again, I go to the registered nurse and ask, okay, if you have these pellets, how long do they last?
The pellets are going to be in your system. Each pellet we put in probably a total of 6 months, but you come in every 3 months to get some more to keep that.
I see.
Keep it going evenly. If you were to, not come back or come back a little later, your levels are going to drop just because that pellet is.
And that's what we're looking at. We're going to look at that little tiny pellet. You get a little, I guess, a scale here. If you see my finger here next to it, there's really not much to it there. Very, very small. And the advantage to that sounds like to me, Dee, that rather than go in every, once, twice, 3 times a week, whatever the case may be,
Right.
you're good for 3 months, right?
Right.
Ooh, I like the sound of that. I would think some of your clients like that too as well, Jan, right?
They do. A lot of people say, I don't like taking pills, I forget to take pills. Or, as Tracy said, they've tried the patches, the creams, and the gels. The problem there, those only go so far into your skin, so they're just not effective enough to do what they need to do.
That makes perfect sense. So, from your perspective, Tracy, as a client, as a patient, this is the method you prefer.
Yes, definitely.
Okay. And you feel good now.
And
do you
really
know when
know
you need to go back in?
You do, and you will know. I call and I'll say I'm on target most of the time. I'll know when my levels need to be checked.
Interesting.
Yes.
Okay, now, and I'm trying not to get too personal.
Okay.
Okay, but this is tough, because it's something people want to discuss. So libido's good. I mean, you're feeling good.
Libido is good. It's really a perk. I mean, by and large, I think that is the perk of it, but
that's not what it's all about.
It's not what it's all about, and I can't emphasize that enough. People think, that's what it is, and that just makes that part better when you feel good about yourself.
There you go. I love to hear that. It's kind of a snowball effect. It's mental, it's physical,
Yes.
the energy levels, focus, all of that. Are her results pretty typical, Tracy's results, Jan?
They are, and she's certainly shared with me in private that it's made her relationships better, not only with her spouse, but
Business.
coworkers, friends, family. So it's just a good thing all the way around.
All right,
It's a win-win.
Win-win, I love that. All right, more with Nova Health coming up. In fact, we're going to talk about a vampire facelift, but we're going to give them a little break. And coming up next, last second Valentine's gifts, folks. Get ready, because if you get to shop for your honey, we've got unique gifts and unique deals from Atlanta, Georgia. Coming up next on Wait Free Listens Live. I have a trio of folks from Nova Health with me, included in that Jan Atkins. She's on the show quite often, and now we're going to talk about something a little bit out of the box, a couple of items, in fact. First of all, I had a little tease there about the vampire facelift. So it sounds pretty cool, but what is it exactly?
Well, the vampire facelift is actually a trademark patented name. Dr. Farmer and I traveled to a little town in Alabama called Fairhope. We met with Dr. Charles Reynolds. He has a patent on all these procedures. He was an ER doc for a number of years, then he had an internal medicine practice. And he really cared a whole lot about people, kind of wanted to get away from mainstream medicine. One of his concerns was weight loss, so he developed a weight loss plan. And he started noticing that people would lose 40 or 50 pounds, and then they would stop, and they would say to him, well, doc, I can see it in my face. My face is drawn in, my skin's sagging. And he thought, well, no, you need to stay healthy, and I can fix that. So he patented this facelift, which is done with platelet-rich plasma. So you're using something that is right out of your own body. There's a vampire facelift. We also have a vampire breast lift. We have something called an O shot and a P shot. With the vampire facelift, you are actually injecting platelet-rich plasma into the skin, and a little bit of calcium chloride is mixed with the platelets, and that generates 7 growth factors. So then your stem cells activate, and that creates the tissue and blood flow.
I did not mean to interrupt you, but the big wow factor here, the before and after. Now, that's why they call it vampire plasma, obviously.
Yes.
So you're saying something already exists in your body, it's just, it's platelet rich. It's more richer plasma, and that's why you get the rejuvenation. The before and after there, Jan, is that typical? That's amazing.
That is typical, and it is pretty amazing because you can see instant results as time goes on. Even 4, 5, 6 weeks out, you're still seeing changes. Same concept with the breast. You get lift, you get more volume. And,
Wow.
and the procedures are all done in the office. There's no downtime, non-invasive, whereas a facelift, you know, that's extremely expensive and a lot of downtime.
So the plasma-rich blood, do you have to give blood and then they inject it back into your face or breast, whatever you're doing? How does that work?
We draw the blood. It is spun down. We use what is known as a centrifuge, and then the platelets are separated.
Right over my head there. Okay. Medical technology. That's okay. I like that.
That's why Dee's here. She can she can delve into that a little bit further.
So Dee, when you're explaining that, like if someone were to have a vampire breast lift, and you're explaining that to someone, how do you say it works? You just say it's your blood, and how does it actually
Right.
activate?
Well, we take your blood, it's spun down, we pull off the platelet-rich plasma. So it's, like you said, it's a big concentration of platelets in your plasma. Then that's activated with calcium chloride, which then causes growth factors to release, which helps rejuvenate skin, develop new tissue, increase blood flow.
You're probably going to have an overall sense of well-being too, I would think, because suddenly it's like you're making your blood younger, and so
Right.
therefore it affects the skin.
Right.
Interesting.
And
Okay.
actually, if you think about it, when you'd have real rosy cheeks when you're a child, you get that tone and texture back. It's really a beautiful color. You don't have the graying of the skin as you age. So, and of course, it stimulates collagen. Which
Okay,
is,
I was a little apprehensive, but after you got to the medical terms, okay, it does make sense. Now, something that's a little sensitive, so I'm going to let Jan take over here, but it's interesting nonetheless. O shot and P shot. Now, what are those about?
I'm sure you can use your imagination. O-shot is an orgasm shot. It is, to simplify it, it would be a women's little blue pill, but in a natural form. It rejuvenates the vaginal area. It also helps with stress incontinence, which is an added benefit. So you're going to regenerate tissue in the vaginal area, ability to have an orgasm if you've never been able to before, or it will actually enhance.
Yeah, so that was my question. Is it for those who cannot achieve sexual satisfaction, or is it for someone who wants to enhance their experience, or both?
Both.
Okay, so that's the O shot.
And then the stress incontinence, that's definitely a benefit. Women that have had kids know all about that. If you sneeze or you cough too hard, you can unfortunately lose some urine.
Okay, that makes sense. I understand. Okay, so now help me out here. How long does this take? I'll ask you this, Dee, since you're the registered nurse. If someone has an O shot, are they instantly having a better experience, or is this something that takes time, or how does this work?
It takes a little time. That once you activate those platelets and those stem cells, it's got to have some time to regenerate. So it can take, for the first 3 or 4 weeks, you're going to, see the bigger changes, and for an additional 2 to 3 months, you'll have things continue to improve, and then it lasts for up to 2 years.
Okay, as if I did.
It's a one-time deal.
Okay. That's it.
You're getting the procedure one time. It's going to last up to 2 years.
That's all it takes.
Yes.
Okay, now, as if I haven't made you uncomfortable enough, but this is something we must talk about.
Moving right along.
Okay, there we go. We're moving along here. The P shot. Okay, help me out, Jan.
P shot is a Priapus shot. It is for a male. It is best for males that have erectile dysfunction, or males that, of course, want to accentuate things, have a stronger erection. You could say it takes the place of your Cialis and your Viagra. So,
And how long does this shot last?
So again,
same kind of thing, 2 years?
totally natural. You don't have any synthetics in your body, which is always a good thing. And this will last up to 2 years as well. And all of these procedures, you come in the office. The bulk of the procedure is drawing your blood and spinning it down with a centrifuge. The procedure itself doesn't take that long. And very importantly, you are completely numb. So.
Okay. Don't read anything into this, because I'm really interested. Okay, folks, let's just go with that. Okay, so I'm going to ask from the nurse's perspective here, Dee. Okay, results that you've received from this, feedback that you get from patients. What do you hear?
patients within 3 weeks or so, they can start to feel some changes. Up to, we've had patients who've done the facelift and come back in for their insert, a couple months later, and you can see the results. You can see the difference in their faces.
And as far as the O shot and the
Very
P
happy
shot,
with
good
that.
results with those as well?
Good results. Very happy
Very
with
happy.
that.
Haven't had any complaints.
Is this something we can expect more from Nova Health? Some of these really innovative, and I know you're results oriented. If they work, you guys may introduce them to the market?
We are currently doing all of these procedures. We may add a vampire facial in addition to.
So these all work, but what I'm saying is if new ideas come to the table, Nova Health, are you all going to keep that kind of a MO and mission of like, look, if it works, we'll bring it to the market, bring it to the city? Because these obviously do work, you were saying.
Absolutely. It's pretty amazing because you can even use it for hair transplant.
Wow.
And I'm sure, John, you'd be familiar. It's been used in athletes, professional athletes, when they need to heal quickly.
I think I have heard about
So,
that.
Yeah.
It has to do with rejuvenating cartilage and all of that stuff and faster healing? Okay, makes
Yeah.
perfect sense.
Basically tricking the body into thinking it's injured. So,
Wow.
yeah.
A lot of information in a short period of time, but if you have any questions, where would they go, Jan? Because I think a lot of people are interested in going, okay, I want some more answers. So where would they go?
Our website is novahealththerapy.com, and of course they can call our office directly. Consultation is always free.
And because of her hormone therapy, Tracy Grimes feels so good. She's saying, John, can I leave? Because I've got to go run 3 miles. I just feel that good. So you're training for an Olympian? You're going to be an Olympian, or what are you going to, maybe decathlon?
I'm happy to be here and just ride my bike, and I'm good.
You know I'm teasing you. You
I
look
know
great.
that.
You look great, though. You all seem very energetic. So once again, Nova Health, we encourage you to give them a call. Vampire facelifts, O shots, P shots, whatever the case may be. Hormone therapy, very successful with that as well. All right, coming up. Valentine's Day is this Saturday. Don't forget, guys, you can remember with the heart-shaped pizza. Kids will love it. The wife will love it. You'll love it as well. Bear Nose Pizza. George is with us. We'll be right back on Wave 3 Listens.